is glaucoma? What is a laser peripheral iridotomy? Hello everyone, I'm Dr. Sujani Shroff, glaucoma consultant at Narayan Nethralaya Hospital, Bangalore. So before we start talking about the procedure itself, let's talk a little about what is this disease called glaucoma. Glaucoma is characterized by optic nerve head damage due to high intraocular pressure or the eye pressure. The eye contains a fluid which is continuously produced and drained out through a sieve-like structure which is present between the clear cornea and the brown part of the eye, which is the iris. In some patients, the space between these two structures through which the fluid flows can get very narrow. That's when a laser peripheral iridotomy is useful to open up this space. The laser is done in the brown structure, which is the iris. Through this laser procedure, the opening creates an alternative passage for the fluid to circulate inside the eye. So is this laser harmful? No, this laser is not harmful to the eye or the body. So how is this procedure performed? This is a very simple OPD procedure which takes less than 5 minutes to do. Once an informed consent is taken from the patient, a drop called pilocarpine is applied to the eye every 15 minutes, at least 4 times, 1 hour prior to the procedure. This drop helps to stretch the brown part of the eye called the iris so that the laser can be done more easily. Once the patient enters the laser room, a numbing agent is applied to the eye and a small lens is placed onto the eye through which the laser is done. So all in all, this procedure is a very short procedure and painless. What are the drops that you need to use post-laser? Usually, we prescribe a steroid drop for at least a week post-laser to reduce the pain, redness, and also to keep the opening patent for the rest of your life. What are the precautions that you need to take when you're undergoing this procedure? If you have any heart conditions and you're using medications for it, please do let your doctor know so that they can take appropriate measures while doing the laser. The drop pilocarpine, which is used prior to laser, can cause some amount of headache, brow ache, and blurred vision, but this usually subsides after 3 to 4 hours. When do you need to see your doctor next? Post-laser, your doctor will ask you to see them 1 week after the procedure. In case your iris was very thick and they feel that they may have to do a repeat laser, they may even call you earlier. So the next question would be, how many times you need to do this laser? For nearly 95% of the patients who undergo the laser procedure, just once is enough. For some patients, this may close over time and may be repeated at a later date. So what happens if you don't undergo the procedure when your doctor advises you to do so? So the angle, which is narrow, will narrow further and it can close suddenly. So if this angle closes suddenly, the space decreases and the fluid cannot flow out of your eye. This can lead to severe pain, redness, blurred vision, headache, vomiting, colored halos, and can even cause permanent damage on your optic nerve, leading to blindness. So who are the patients who require this laser procedure? Patients who have a narrow angle and those who have a risk factor for developing ankylosure, like those with a family history of ankylosure glaucoma or a high plus power in their eyes, those who require frequent dilated fundus examination to look at their retina, or any patient who has any suspicion of glaucoma when viewing the optic disc will require this laser procedure. I hope this video has given you useful information about laser peripheral iridotomy. If you have any further queries, please do contact Narayan Nethralaya helpline. Thank you.